Yes, kia ora. So my name is Emma Rawson-Te Patu. I'm the President-elect of the World Federation of Public Health Associations. I'm the first Indigenous woman to be elected to that role, so it's a great opportunity.
Fantastic, congratulations on that. You've been speaking at the Health Promotion Symposium here in Geelong in Australia, but it comes, one of the things you raised was in the wake of the New Zealand election, and you talked about first the promise of the Maori Health Authority, but also that that's one of the things that is now at risk there. Could you just expand on that?
Yeah, sure. So for some years in New Zealand, we've been working towards understanding a true treaty model in terms of at central government level and decision making, and we were able to achieve that 2 years ago with the establishment of Te Aka Whai Ora, the Māori Health Authority, alongside the Health Authority under a new version of our ministry. And that it was in the wake of the good work that Jacinda Ardern and her Labour government had been doing in terms of understanding and addressing the treaty needs and again, as I said, the decision-making model that affords us. What we've seen with the last election 2 weeks ago in New Zealand is a change in government from a Labour-led government to a national government, and in the lead up to that election was a lot of politicking around National's desire to disestablish the Māori Authority with the justification that it's race-based health service provision in the negative. So that certainly seems to have served its purpose in terms of driving those people in New Zealand who feel that way to see enough swell shift to have a change in government. We are in some ways not as worried about that being able to happen in one instance, because there is a legislation that was also put in place alongside the Health Authority, which is called the Pai Ora legislation, and that requires government to ensure that all its actions in terms of health resource distribution and decision making has the focus on addressing Māori health inequities at the core. So it could be a lot more difficult than they imagine, but the other aside to that is there's been so much work done and so much gain happen, is that some of us believe that it will be too hard because the social sentiment will be too great in the positive towards keeping Te Aka Whai Ora, that may make it difficult. At the end of the day, it's always worrying when there's a government that's not as favourable to Indigenous-led outcomes or the idea of truly understanding how to address the inequity, but we just remain hopeful that there's been enough work done that will keep the work on track. And at the end of the day, the work is going to be the same if they undo it or not. We still need to forge forward with what we know is right.
But what strength does it give you that forging forward, in any other way doesn't? What is it about it as an authority?
It's a recognition of the actual state of where our people are at in terms of how we have a lesser access to the determinants of health and how we actually ended up in this position, in this space, as the receivers of a treaty that didn't address or take care of our equitable health outcomes. So it's that acknowledgement that's really key and important in this space, moving from an apology and an acknowledgement of Māori as Indigenous people, the place that we hold in the land, and then moving that acknowledgement to actual action within central government was absolutely key.
So at the heart of what you were saying about the Maori Health Authority is the fact that there is a treaty there in New Zealand. Here we've had the failure of a much lesser advance through the voice referendum. You talked today as a health promotion practitioner. It was a call to action, some challenges, some calls. What were you trying to get across?
Yeah, I think the biggest message is the need for bravery, and bravery is always difficult when things are the hardest, and when I said bravery, I'm really talking about the non-Indigenous contingent of our community, our health promotion community, our public health community, and the community at large, to lean into understanding why the result was the way the result is. I think those of us that really understand our historical context and the places in which we fit really know that the right answer would have been yes. at any stage, giving Indigenous people a voice at central government level, having the sovereignty over the decision making around how health systems work, how government decisions are made, policy is made, is core to acknowledging first and foremost the existence of a people, and then also the importance of the way in which our people live. And unfortunately that's been missed in this instance. The health promotion community, the public health community, can be really significant in being braver about understanding how they fit in moving forward the Indigenous health agenda, the Indigenous agenda generally within the country.
Yeah, what's it, historical literacy you talked about, I think, and just that issue for non-Indigenous people around the idea of losing something, and you talked about how to speak back to that.
Yeah, so historical literacy is really important. Unless you understand the fabric of your nation, where it came from, that's also really brave, because for generations, not just in this country but in my country and many other countries similar to this, there's only been part of a story being told, and a lot of people can feel fear about leaning into learning new things that are maybe uncomfortable or unpleasant about our history, but it's only when we know these things can we actually start to develop real solutions. And so my invitation was to the greater community, the greater public health community, lean into knowing and understanding your historical context, because then the bravery of the work begins around how we actually develop real solutions, how we begin to absolutely understand how to share power, how to truly share resource to ensure that the inequities that exist are addressed.
The other point you made was if you can't achieve things at a national basis, you can look globally, and that speaks to your role now. What sort of mechanisms are there that people can look to? A lot around Indigenous health and equity, but also just more broadly perhaps?
Yeah, again, really interesting observing the referendum and then the general election in New Zealand, but not just in New Zealand, the general shift away from the left to the right in terms of, government, governmental shifts in elections. I'm thinking about Norway and many other places that we're seeing this shift occur. And I guess the reality is that we know that political cycles only last so long, and so something is only going to be in fashion, if you like, in terms of the thing to address for that political cycle. So I think the reality is that we can look to the global mechanisms and global collaborations as ones that can be sustainable much longer than the normal political cycle with any nation. And so that's really what I was talking about. So absolutely the disappointment that we felt about seeing what happened in New Zealand with the general election, but remembering there are other mechanisms. So the World Federation works very closely with the WHO, so how can someone like myself and my colleagues and the people that work alongside me, how can we influence the decision making in terms of public health and health promotion in regards to Indigenous communities at that level? How can we work together more collaboratively, smarter with other groups that are doing the same work in the same spaces? And then you've got the UN mechanisms, which, both of these organisations, they're slow moving and they're clunky, but they're also starting to understand and appreciate, have an appetite for the significant value that comes from Indigenous knowledge, and that really comes in with the climate change questions that people are beginning to face and wanting to say, well, how do we address this? And then Indigenous people who've been here for millennia have the answers to this, and so people are starting to appreciate actually there's something here. So capitalising on that appetite, working together to be smarter, to be more agile, to get more done in a shorter space of time at that global level, I think is a very real opportunity.
And it's a bit mean to ask you this when you haven't even taken up your position yet. Is there one thing that you would like to achieve as president of the association, the Global?
One thing.
5 things.
Yeah. Look, I think if we can, so for me a really easy one is to establish a permanent Indigenous seat on the Governing Council of the World Federation. In my mind, that's a really quick job that can be done that will ensure that voice remains at that table from now until as long as the existence of the Federation. that's one thing. The other thing is we have this new goal of systems change approaches and decolonising public health that we adopted this year at the World Congress on Public Health in Rome. For me, it's about ensuring that there's a plan in place that's achievable and realistic, that helps the broader public health community through our membership, which is 104 national associations plus other associate members, to understand what that means, and then to be able to lean into the challenge of beginning the action to decolonise public health. It sounds like a lot, but for someone like me who's been working in the space for some time, there are some simple ways of imparting those messages, of helping to support people to understand these things. And so I'm really hopeful that we'll be able to achieve a number of wins in that regard in the next 2 years.
Fantastic. Thank you so much, Jen.
Thank you.